Hello, my name is Samantha Olds Frey, and welcome to IAMHP's Executive Corner. I'm the CEO of the Illinois Association of Medicaid Health Plans, and today we're talking about the collaboration that's required in healthcare, why it matters, why it's so difficult, and how you can listen to our upcoming podcast on collaboration with Dr. Margaret Kierkegaard. Collaboration is critical, especially when we think about Medicaid and healthcare, because there are so many moving pieces. And at the end of the day, you're not going to get the outcomes you want unless you are all moving in the same direction. Because what a doctor does with a member who is perhaps diabetes doesn't necessarily impact the outcome unless that member is able to get their insulin from a pharmacy, to eat healthy food, to exercise in a safe manner, who has a hospital should they need one, that is in sync with the patient's care plan. And then at the end of the day, also a Medicaid health plan that sees all of these moving pieces and is assisting the member in navigating a complex healthcare system in an effective and efficient manner that meets the needs of the member and is taking away social determinant of health barriers to the best of their ability. And so there are very rarely in healthcare anything that a single organization or individual or even industry can tackle on their own, because so much of what determines our healthcare outcomes or our well-being happens outside of the four walls in which an individual or organization has control over. So for a doctor's office, so much happens outside of their practice. For a hospital, so much happens with regards to healthcare outside of their walls. And for a health plan, we really need the collaboration and the partnership of the doctor, of the hospital, of the transportation organizations, of the pharmacies, and then also of those community-based organizations to support the member. And so while our goals and our mission and our priorities often align, it can be hard and difficult to get everybody on the same page and moving in the same direction. And that's where the importance of collaboration takes place. However, as we talk about often, simply because something matters and is important doesn't mean that it necessarily is taking place. And that's because it's difficult. It's difficult to get all of those moving pieces on the same page and moving in the same direction. And to that is why we talk about in our upcoming episode of Sam Says with Dr. Kierkegaard, a principal at HMA, about the importance of collaboration and how it is in fact quite difficult and what individuals and organizations can do to make it successful. Some of those things are going to be really simple, like making sure you're writing down your details and your ideas so that people can take them back, interpret them, respond to them, and make sure that just because what you've said in one way there aren't assumptions in the middle there, and that we're all talking about the same thing. Face-to-face collaboration, such as Zoom or webinars, if in-person meeting is not possible, and making sure that you're seeing one another and interpreting both your verbal, but then also your physical communication. And then finally, a willingness to collaborate. It's not enough to bring people together. They have to be willing partners, and they have to want that change. There has to be a synchronization of priorities, of goals, and a willingness to change the way that all of us or those of your collaborators are currently functioning. If there's not that willingness, then you're not going to be successful. And so collaboration is absolutely critical for the success of healthcare interventions, especially in the Medicaid space, but it is something that's difficult, and that's something we're going to continue to tackle and discuss over time. So again, to find out more, please listen to our upcoming podcast, Sam Says with Dr. Margaret Kierkegaard. And then as always, do feel free to like and follow us on social media, LinkedIn, Facebook, and Twitter, and check out our website, IAMHP.net.